Today, let's learn about iron deficiency anemia, the most common type of anemia in the world. Anemia means your blood does not have enough healthy red blood cells to carry oxygen to the body. In iron deficiency anemia, this happens because there is not enough iron, an important building block for hemoglobin. Common causes include blood loss, like in heavy menstruation, or stomach ulcers, or trauma, poor diet, and increased need as during pregnancy or growth. Symptoms may include tiredness, pale skin, brittle nails, poor concentration, dizziness, and shortness of breath. Doctors diagnose iron deficiency anemia with blood tests, which usually show low hemoglobin and low MCV, which indicate microcytic hypochromic anemia. In iron profile test, we check serum iron and serum ferritin, which are low, and in peripheral blood smear, there are pale red blood cells. Treatment include iron supplements, improving diet with iron-rich food, and treating the cause of bleeding. With proper care, most cases recover fully. Stay healthy, eat well, and don't ignore the signs of fatigue.